Most of the time, it's for really sick neonates. So that's a patient that's under 4 months old. Usually those patients are born really small, so they're premature. A lot of them have congenital problems such as cardiovascular issues or issues with their lungs, their kidneys, which require them to have blood transfusions in order to keep them alive. Because they have a lot, if you think about the size of a baby, they have a lot less blood than an adult. So we have to supplement them in order to keep them going. Clinically, we worry about things like the weight of the patient and how much blood we're giving and how many blood products we're giving. The amount of donors we're subjecting them to as well. So we worry about the volume, making sure that we're not giving them too much based on their weight. We worry about whether or not they have congenital issues, other immunological issues. So we irradiate the red cells so they can't multiply in the system. We check for a virus called CMV to make sure that it's not present in the red cells so that we can transfuse the baby and not worry about the patient catching that. A majority of our time is actually spent less on the specimen itself and more on taking the full unit and dividing it down. So that's how we use the transfusion system as a computer system, is to make sure that we divide it properly, we label it properly, we put it in syringes, we change the expiration dates to make sure that it's compliable with the FDA. So we're following all the FDA rules and all our other federal and state regulations. We've started discussing using WellSky when we were changing computer systems. So the hospital's computer system, which has the electronic medical record, went with a company called Epic. They suggested that we start talking to WellSky, and then they also suggested, for a hospital, you always have to have at least 3 vendors. So we looked at 2 other vendors, but WellSky had a lot of the safety features we really wanted, especially at issue. So when we issue the product, it has about 15 double checks to make sure we're doing everything appropriately and we're not missing anything that could harm the patient. I guess the top thing would be the validation that we're doing our job correctly and making sure that what we've typed the patient as, their ABO and RH type, matches what the product that we're giving, and it won't let us issue that product without that double check. So a lot of the safety features are the biggest things for us.